Hello friends, welcome to this lecture, the Nuremberg trial and the Nuremberg Code in the 1940s. So what is Nuremberg? So after the Allies won the World War, Second World War that is, they held a legal proceeding to charge the guilty Nazis for the horrendous activities they have done. And what is of concern to us is the doctor's trial, as it was called. So why is it a doctor's trial? 23 doctors were charged and 7 received death sentences. What were the charges? Human experimentation and mass murder. If you look at picture 2, that's Dr. Karl Brandt, that's Adolf Hitler's personal physician, and he's wearing headphones for obvious reason. He's German, he cannot understand English. And then can you imagine what's going on in his mind? I mean, what was he thinking? He's a clinician, he's supposed to help people, and he instructed Hitler to come up with gas chambers and so forth. It's horrible, but it happened, right? So let's see what happened. So examples of these horrible Nazi experiments done, just so that you know, victims were exposed to low pressure, that is the equivalent of high altitude. They were made to drink a lot of saline water and so forth. And then this was not based on science at all. And then the victims or the subjects didn't consent to it. Obviously they couldn't consent because they were prisoners. They were held in prison camps. So how horrible it was. So anyway, during the Nuremberg trials, the lawyers and the personnel there, and there were a few doctors as well from America and UK who participated, and they came up with a code so that it doesn't happen again. Such horrible acts don't happen again. It's almost as if these codes were given by God. I mean, God saw that human beings can do such horrible acts, and then he handed over these 10 commandments to us. It's not religious in any way, but it's a nice way to think about it, isn't it? So it's a beautiful picture. And the 10 commandments. So let's see what are these 10 commandments. So the first one is that voluntary, well-informed consent is absolutely necessary to take part in any sort of human experimentation or clinical trial. And then which is very important, is that the subject should be of full legal capacity. So it cannot be a mentally handicapped subject or somebody who cannot understand. It should be of a subject of full legal capacity, so they can either agree or say, okay, I don't want to do this, right? And the second one is that the experimentation or the clinical trial, in Nuremberg Code they didn't call it clinical trial, but I'm just using that word because that's the industry we are in. They just use the word human experimentation. So this experimentation should procure to obtain some positive results for society, which cannot be obtained by any other means. So what does this mean? It means that if this information from the experiment is already available, or it can be taken from some other methods like observation of a population, or historical observation of a historical event, and then get that information. So no need to do the experiment, because you can already procure the information by observing a population, like doing observational studies. So you have to show that this human experimentation need to be done, so that we get this information which is beneficial for society. Did you get what I mean? So you have to justify the experiment. So the Nazi doctors, they didn't justify anything. They did whatever that came to their mind. They didn't check to see whether they can get that information from elsewhere. And what's the third one? It should be based on previous knowledge. Example, animal experiments or clinical trials which were already done, which justifies the experiment. So it has to be scientific. So the Nazi regime, they never did this. They didn't justify the experiment. They didn't show animal data or other clinical trials to justify this in human experiments. So from lesson learned is that we need previous knowledge. And third one, which is very important, this speaks to my heart, need to avoid unnecessary physical and mental suffering and injuries. This is a beautiful picture. So Lord Buddha stated this many thousands of years ago. I teach only one thing, and one thing only, that is suffering and the end of all suffering. So Of course, in all his wisdom, Buddha stated this, but of course people don't pay attention to it. But after the Nuremberg incident, we have to learn this. We have to respect this. We have to respect human life and help to end suffering. So this is very important. And then the next one, should not be conducted when there is any reason to believe that it implies a risk of death or disabling injury. So this is a very nice picture. So if there's a trial where the person is supposed to hold a high voltage electric current, no, you shouldn't do it. But the Nazi doctors, they didn't care. They didn't care whether the patients died or subjects were disabled. The whole point was they wanted them dead, so they did experiments anyhow. So anyway, the lesson learned is it should not be conducted when there's obvious reason to believe that it implies death or risk of disabling injury. And then this is very important. The benefits have to outweigh the risk for the subject. So the benefit for society and the benefits for the subject should outweigh the risk by many folds. So it's a beautiful picture. So if that is the clinician who is doing the trial, he or she should always balance in favor of the benefit and less risk. So benefit weighs more than the risk, right? So this is very important. And then the next one, preparation and facilities are ready to go to protect the subjects against experiment risk. So this is an oxygen mask. So I'm not saying it's just the oxygen mask, but it's a good way to understand this event. So let's say you do a high risk clinical trial, and then the patients need to be monitored 24 hours. So there's the big team of doctors and nurses, and there's medication to help the patient if there's some sort of adverse event. So all those facilities should be there, right? Do you understand? Hope you understand. The next one, the staff must be fully trained and scientifically qualified. So what does this mean? So if it's a doctor, they should have medical registration and they should be licensed to practice medicine, and any other scientific members should be properly scientifically qualified and suited to do their tasks. So was the Nazi regime doing this? No. The doctors, maybe they had medical registration, but of course most of the experimental procedures were done by the Nazi soldiers who were not scientifically trained. They were just following rules. They didn't know any better. Anyway, so this is the lesson learned. And then the next one, so this is so important, and the picture speaks 1,000 words. So if that is the subject, if the subject wants to quit, he or she is free to quit anytime they want. And when they feel physical pain or mentally unable to go on, they are free to break away from the shackles or break away from the requirements of the experiment. This is very important. And this is a beautiful picture. Medical staff must stop the experiment at any point when they observe that continuation would be dangerous. So if there is an experiment or a clinical trial, is that a camel or a giraffe? I think it's a giraffe. Where the giraffe is about to eat the head of the subject, you will immediately stop the trial or the experiment. Do you understand? So hope you had a bit of fun with that. And my motto is always have fun and keep your energy going so you understand more. I know it's deep, but having fun and really engaging with the material, it helps you understand, right? So that's the end of the lecture, and hope you understand the Nuremberg Code. So by no means are you supposed to memorize this code, but understand and appreciate it. So these rules will come up again in good clinical practice, and we will go through it thoroughly then, but understand the historical events, how it made people come up with these rules and these guidelines, and appreciate it. So I'm happy to have done this lecture with you, and hope to see you in the next lecture. Ciao for now.